Here. I welcome you to this 22nd of February, almost into March, and hopefully this year and this winter we'll go into a beautiful spring and summer here. So this is the Housing with Services team meeting, monthly meeting, and I'm going to go into the prayer, I think. Okay, it doesn't want to page down. Maybe I won't go into the prayer. There we go. Okay. If you care to join me, please do, but please center yourself and I will read aloud for us. Heavenly Father, we come to you today asking for your guidance, wisdom, and support as we begin this meeting. Help us to engage in meaningful discussion, allow us to grow closer as a group, and nurture the bonds of community. Fill us with your grace, Lord God, as we make decisions that might affect the residents, family, and associates of Benedictine, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth and the greater glory of you, and for the service of humanity. We ask these things in your name. Amen. Okay, now there may be some, feel free to unmute yourself. We did not meet in January because that meeting was in, we'll touch on this a little bit later, that meeting was going to be focused on modified diets, and then we slowed that down a little bit. If you see that Denise is on the call, so I may ask her to weigh in a little bit, but as far as I know, the only new leaders we have that came in January were George Kratky, who is the new Madonna campus executive director, and Sheila Larson, who we talked about, but didn't start until January. Do you have any other leaders?
Penny, your voice is fading and then coming in strong. I don't know why that might be.
Okay, thank you, Jerry. I can switch to a different headset. Let's see if that helps. Let's see. Okay, how about now? Is that better?
Yes, ma'am.
Okay, thank you, Jerry, for pointing that out. All right, so do we have any other new leaders on the call? Okay. And you guys are allowed to unmute yourself so that we can have an interactive discussion, but when you're not talking, please mute. I hear somebody with some noise in the background of their house, I hear some kids and such, so please make sure you're muted. All right, so go on to the next one. So this next agenda item, I'm going to welcome Patty to the team, but or to the discussion, but I wanted to explain where it's coming from. Right now, our leases, the newer leases, say that you have to give us notice. And most of all of the leases, old or new, have some level of give us notice. Give us notice in, for time to clean out your apartment. 7 days, 10 days, 30 days is typically the standard. Many, if not all of them, you know, again, the newer versus the old, have some sort of notice after death as well, which is very in line with the community because we are, in addition to assisted living, we are housing. And so that typically comes with a notice. Where the problem lies in is that right now what we're doing is we are taking people out of the census on the day that the person no longer occupies it. And if the lease or the payment for the apartment goes longer, they're not showing up in the census. So that apartment's not available, we can't rent it out, but it looks like nobody's living there and that our census is worse than it is. So in talking to some of the folks and to Steve on OLT, and we're going to bring this back tomorrow, we really wanted to accurately reflect the census that you have and the occupancy or availability of the apartments that you have. But that poses some pros and cons. So Patty's going to walk us through what her potential solution is, and then we want your feedback on what are the potential ramifications to you, what do you think, and then I am going to bring this to our operational leadership team tomorrow where we can hopefully get this finalized. So I'm going to bring up Patty's PowerPoint, and Patty, are you on the call?
I sure am. Okay.
All right, take it away, ma'am.
All right. So Penny, I don't know if you want to, in the PowerPoint, I have, do you want me to share my screen and run the PowerPoint? Would that be easier?
Yeah, I'll stop sharing.
Okay, maybe that would be. All right. Okay, can everyone see my screen now?
Not yet.
Okay, let me, helps if you share your screen, huh? There we go. How about now?
Yes.
We can see it now.
Awesome, thank you. All right, so as Penny stated, last September on this meeting, we had set up the new rent after discharge or expiration in housing. So I did just kind of an overview on what we are currently doing. So we're discharging that resident in or putting that resident to expired in the census. And then if their tenant lease agreement reflects that the new leases for the 30 days or from the end of the month, we would set them up as an outpatient and run rent after discharge through charge entry. As Penny mentioned, the problem with that is it makes the room look or the apartment look as it's available when it truly isn't. So after much discussion, and we worked with Matrix in several different scenarios, and again, this is just what we're currently doing here as a recap. We came up with a new proposal, and what we want to do is run this past everyone who uses the census and the process. And from our eyes, we saw an issue or two, but we want to make sure from nursing to operations to business office to everyone that it works for everybody. So we're going to share our proposal, take some time to think about it, and email us, or right now, this is open for discussion. Bring us your questions. So what we would do is at the time of the physical discharge or the tenant expires, we would put the tenant on a therapeutic leave. We would set up a therapeutic leave that has a census event attached to it that says tenant discharged, continued rent, or it would be a therapeutic leave, tenant expired, continued rent. What this does, it alerts nursing that the tenant is no longer in-house, just like if they would go on a true therapeutic leave. And it also keeps the apartment occupied for the 30 days or per their lease agreement. When the apartment is empty or the 30-day notice is up, again, per their lease agreement, Benedictine would then enter the discharge or the expired census event. So 30 days from their expiration, you're going to take them off that therapeutic leave and go in and do the actual discharge or 30-day, or excuse me, expiration or discharge census event. So the issue we see with this, if this process is implemented, is the census reporting could look different. And you can see what is going to be the change here is if today, John Jones expires, I'm putting him on a therapeutic leave for 30 days, and his census isn't going to show expired truly for 30 days. You're going to see that therapeutic leave that says, therapeutic leave, resident expired, continued rent. But if you're running a census report or anything like that for discharges, it's not going to be true to the actual discharge or expiration. So any questions, comments, concerns
Well,
with that?
oh, sorry, Patty. This is Patty. I think you brought up another point, just to really call it out. So the way that Patty just described it on the Jackie Glenn report, on the SAM report, where it talks about the census and all of that, it would reflect that apartment is occupied. But especially like in expiration, if somebody's looking at the record, 20 years from now, and when did that person actually die, you're going to have to look into the notes to see that they truly expired 30 days earlier. So that's one of the potential, is that an issue? Is it not? Which way would we rather go? What other issues are you seeing?
Penny, this is
Yeah, and
Jerry.
this, oh,
Penny, this is Jerry, and Patty, thank you for your work on this. One of the issues I'm seeing with this is that when the survey team comes in and says, what's current census, we might not have clarity.
Good point. Now, Patty, on that one though, wouldn't it show just like when the survey team comes in and a couple people are in the hospital? Wouldn't it just show them as they're on census, they're just not here?
yep, so it's going to show them just like a hospital or regular therapeutic leave. Whoops. And it is going to say therapeutic leave, tenant discharged, or therapeutic leave, tenant expired. So again, to Jerry's question, is that an issue?
I believe the health department really looks at the roster versus the matrix census too, in the AL anyway.
Where does the roster come from, Linda?
It's currently a manual process that we have to do per MDH. We just now got it into senior living, and so everyone will be working on getting that into senior living, and then they can just print it when they walk in.
Okay.
So we have a question here relating to that. When would we be moving them from an active roster to the death roster? Linda, can you tackle that?
MDH, you would put them on the death roster the day they died, it has nothing to do with the apartment rental. Little different. Housing is just a little different.
Other questions or concerns?
So what would the date of death be in the medical record?
The day they died, but it would be a nurse's note.
Again, the census will say therapeutic leave, tenant expired. But again, that actual expiration on the census wouldn't come until the 30 days are up.
Penny, it's Barb. Can you hear me?
Yep.
So, I think the intent here, A, is to get the census correct, but also to stop the nursing charges and continue the rent charges, correct?
Well, in a memory care, or if it is to take them out of the nursing picture. So in memory care, the full global would continue. In assisted living, it would stop. But yes, it's so that nursing knows this person's not here, don't go searching for them.
Okay, so that was my question about the memory care or the enhanced assisted living where it's all one charge. And then just the other question is with the new lease documents, and I apologize that I don't know this, but someone who passes away, it's still considered a 30-day from that date of expiration?
Yes, the current lease in Minnesota and North Dakota say that if you are leaving by your own choice or by circumstance, but you are still with us, you will give us 30 days plus till the end of the month. So if I give notice on July 15th, I am paying till the end of July and then the full month of August. So that's 45 days. If I die, I'm giving a 30-day notice. And again, the reason for that, especially it's in all states that we've checked the rules and regs, but particularly in Minnesota, because it's housing, it kind of follows the standard housing. You need time to get your furniture out. You need time to do this. If you're giving notice, and so it's very similar to the community, where if I gave notice to an apartment or some other circumstance, I would need to give notice, whether for whatever reason that I left, whether I died or because I chose to leave. But it's a shorter notice on the death. So it gives them time to make that transition as a family.
And
Penny,
Yep.
this is Stephanie from the Escalon. Could you say again about the person who gives notice on the 5th, they pay the rest of the month and then the following month?
Yeah, so you're in Illinois and Ben did write a new contract for you, but I'd have to go back and look at yours just to make sure I'm saying the right thing. But in general, the Benedictine standard, unless the state has rules that are otherwise, it is a full month's notice. So if you are choosing to leave and you put in your notice in the middle of the month, it'll be till the end of the month and then a full month. If you expire, it is 30 days. Now, in all of these cases, if you can get your stuff out of in a shorter period of time and we can lease that, we will let you out of it earlier. Or every lease says that the lease can be terminated at any point by mutual agreement. So if there are unique circumstances, it does allow us some flexibility in those conversations. But as a standard, in line with fair housing, that's what the notice is. And all of us, whether we call ourselves housing or assisted living or whatever, fall under that fair housing.
Thank you.
You're welcome. And so that's where, like I said, and you guys know this better than I do, nobody's completely out the next day after they give us notice. It takes time. And so the question is, during that time where that apartment is still technically owned by somebody, do you feel you need to get credit for that census? I can tell you Steve Prisbilla feels that you should. His goal is to have that census accurately reflected. But it's like there are two very different ways of looking at it, and that's why we wanted to give some input as opposed to just saying this is the way it is. So other folks, what are your thoughts? You want to think about it a little bit? I'm just going to pick on one or two here. Jake, Gary, and I know you're on. What do you think?
Oh, Penny, I don't have a thought on that one.
Does it matter to you? Does it matter either way? Okay.
No.
All
No,
right.
it doesn't.
Okay, Jessica says, I think that idea would work well for us. Sheila says, hi, Penny, this is therapeutically discharged, meaning a resident is hospitalized or rehab for a period of time. Yes, Sheila, that is typically in any other circumstance other than this one where it's upon discharge, that's what you put them on when they're not in the building so that they're still in census, but nursing is not looking for them. Okay.
Penny, this is Kendra from Osseo. Would this also apply for people on EW, knowing that we're not bringing in that revenue, but the apartment still can't be leased out because it still is occupied?
That's a really good question, Kendra. Because they're not paying rent on that, and we should be giving them a period of time. Usually we say 7 days before we kind of move the furniture ourselves. Let me get back to you on that, Kendra. That's a really good question. Do we want to set a standard because it's not occupiable?
Penny, it's Bill. I mean, we have to get them out as soon as we can, I think, because they're not going to have that. No one's going to have that 934 once they pass away to pay for another month's rent.
Right. And I think even though technically,
I agree with what you're going to say, I'm pretty sure, but they don't have, who's going to pay 934?
Their rent stops the day they pass away for EW too, so.
Right, but what Kendra is saying is the room's not available. However, it technically is not owned by anybody because the rent stopped. So yeah, I think from what I just heard Bill say and Linda say, I would say that no, theirs stops the day because they don't own it anymore. They stopped paying for it, so they don't own it.
Right, it's just hard to get them to get their stuff out
Yep.
so that you
Well,
can
usually-
re-rent it.
Yeah, usually like if they, let's say they pass away today, you know, they've already paid for the February anyways. So, you know, it just depends on how full you are and how bad you need the apartment, how soon you need them to get their stuff out.
Right. So I
Gotta
think
have some
that's,
compassion.
yep. I think that's a good question, but I think it's a little bit of a separate issue, but a really good question, Kendra. So I'll double check that one, but I would say again, they stay in census as long as somebody technically owns that apartment. So if you had, to Bill's point, if you had somebody who was available to move in that next day, you would work to move the furniture because that person doesn't own it anymore. So I would say no for the EW.
Makes
So-
sense.
So think about this a little bit. Again, I'm going to take it to LLT tomorrow, get a consensus. We'll wait a couple days just to see if anybody raises any red flags. But it sounds like based on what we're hearing so far, pending any middle of the night red flags, we'll probably start this. What do you think, Patty? March 1st?
Yep, that can work, March 1st. That's how you would change from doing what you're doing currently in the census.
Okay. Thank you, Patty.
You're welcome.
All right. Just a reminder, and I've been traveling last week, so it may be in my email. If you already did this, I apologize, but I didn't get a lot of response from our December discussion around the Roche INR program that is now BioCal. So you have to re-sign up for it. So this is for persons who are doing INRs as a service in your assisted living, where you would order a meter per person or a centralized meter and strips per person that can be delivered to the person or delivered to the nursing office. Many of you do have a lab that is coming and doing your INR, so you don't need to provide this as a service, and that's fine too. Just shoot me an email and say, I don't do INRs, and that way I can check you off the list. So that's just a little friendly reminder. So the modified diets, I see that Denise is on this. So in December, we did meet. We were going to have this meeting kind of about the modified diets. There was some training on it in the DON meeting. I know I wasn't on that meeting, Denise and Jerry, who I know are on this call, but we did get some questions that we wanted to just regroup as a team one more time before we kind of rolled this out. But Denise or Jerry, do you want to say anything about where you're at or anything at this point?
All policies have been updated. They're out there for you to take and use. We did go through on the DON call with the DON, the ALDONs through this. So it was good discussion. I'm not aware of questions. I think the only question I have, Penny, is there any change to fees that are charged if we do this?
And I think that was one of the open for the group that we want to discuss, just to get a few things, and we can put that on the OLT agenda tomorrow too. So it is possible, and what Jerry's talking about, and so again, if when we're talking about meals that we prepare, are we charging for that extra work, or are we charging for that pre-purchased thickened liquids or what have you? For them in their room, we could give them resources, but they would need to buy their own stuff. So we're just talking about, would there be an upcharge on our meals for a modified diet? And so that was one of the remaining outstanding questions. So we'll get that resolved, and then again, set up similar training to what the DONs had. So Denise, do you want to add anything here?
No, I did review the information with the culinary leaders last week, and so that they kind of understand and know that modified diets, that they can provide these in assisted living and independent living communities now, because it's a bit of a change. So they have been informed, and the great tool that really helps us be successful with this is the meal suite software that we're implementing. It's a great tool. And we are implementing IDSI across the organization, And so that's an opportunity for us to be kind of standardized in work, whether we are in a skilled facility or a housing with services, we can talk the same talk, so to speak.
Perfect, thank you. And then
Yep.
as we talked about in December, this is a part of that getting to yes when we look at our census and really feeling that, you know, we, in most of our buildings, we cannot do CPR 24/7 because we don't have basic life support trained persons in 24/7, but people still have a right to live there as long as they know that reality. The same deal. People know that if they are at risk for choking and they choke, that we would have to call 911 unless there was somebody trained in basic life support. It's the same sort of deal, but people have rights to make that decision, and we want to make sure that we're empowering those rights. So if you have any questions, you know, as you said, the DONs were trained, the culinary folks were trained, we're all here, and then there'll be more. I think Denise is probably, hopefully, still willing to provide one more training for the housing leaders with the team that's been doing this work. So
Yep.
more to come on that. Okay, so the end of month process. We talked about this in December as well. Just Linda and I, as we go out to the buildings, what we're doing is we're looking at your transaction report, which is what you actually build people, and we're looking to make sure that that matches what nursing says the level of care is, and the additional charges and things that we're doing for these folks. And so already Linda in her work with Matrix has generated additional reports that make this even simpler. But I've also been getting some questions. So I want to pull into the screen a little cheat sheet that I created, and I'll send that out with the minutes. And let me make it bigger so you can see it. Okay. So basically, this is just a step-by-step instruction on what you should do at the end of the month. Now, in the nursing homes, they have this thing called triple check that is up on eSource, where you can kind of check off, did I do this? So I'm kind of working on, you know, what is this something that should be on eSource with a checklist like that, or is this suffice? So let me know if you feel it would be easier to have a checklist, because I certainly would like that feedback. But here's something that you can use. So it basically says, step one is I want to print up my daily levels report, shows you where and how to do that. And you can see here, this is the care level. So this is the care level that should be being billed out. So then what you do is you run your billing transaction report. And again, here's where it is. Pictures, shows you how to get to this transaction report. And then you just want to make sure that those two match. So make sure that these two match, even if it's EW, because even if it's EW, you want to make sure you have the right level in so that your contractual adjustment, or the difference between what they would have paid and what they did because they're EW, is your contractual adjustment. You want to make sure that that's accurate so you can see that line. So that's the first two steps. Make sure those match. Then you want to run your extra service report, and this shows you how to do that. And this one takes a couple screens to get to it. And it's right here, point of care, extra services, senior living. So in this one, nursing is to verify whether billable based on the plan of care and the levels of care. If truly outside of the service package, always billed. If reasonably assumed to be included, you would not charge. So here's an example. If somebody is a level 7, that's 3-4 hours of care a day. And if incontinence care is a part of that service package, you're going to assume that occasionally they're going to have an accident and you're going to have to help them with that. So you've built in that room for good days and bad days in that level 7, because it's not a 15-minute one-time thing. It's an hour spread that gives room for that. So that you may not want to cover. But if somebody is a level 1 and all you do is the TED socks, but they had an accident, put on their call light and needed your help, that would be an extra charge. In memory care, obviously you wouldn't charge extra because it's a global rate. So again, the nurse would look at these extra services. She or he would determine whether this is something that is truly outside and billable and reasonable to charge. And then they would bring that forward. And then the business office would make sure that they enter those charges. Step 4, and again, not all of this applies to everybody because not all of you have an IL, but many of you have an independent living, and in those independent livings, you often charge for a response to the calls. So you want to run your call light report list. You want to make sure that anybody who pushed on their pendant that wasn't an IL is getting charged. Last, you want to make sure you've got your meal delivery and additional food purchase available. So again, if it's, you know, and again, Denise is on the call, but if we are saying we refuse to have you come to the dining room because of COVID or whatever, you would waive that. But if our dining room is open and they are still choosing to stay in their room, then we would charge them a meal delivery fee, and we want to make sure that those costs are in there. So again, you're looking at your transaction report and you're checking, am I seeing all of these charges before they go out the door? Maintenance and housekeeping, are they additional services? For most of you, if it belongs to us, if it's the stove, the refrigerator, whatever, there's no charge. If it belongs to you, there is. If you're having us come in to hook up your new TV or build your new IKEA bed, whatever, we're going to charge you for that. And so again, make sure that's included where that's appropriate. And then many of you have retail items. So where is the incontinence products, or, you know, what have you, or if some of you have, like, you can buy stamps, etc. Where are those charges? And then the last is what Patty just talked about. And you want to look at who is on those leaves, where are they at in their 30-day notice, their 45-day notice, whatever. Make sure that's accurate, and we're discontinuing them whenever. So this is just kind of your quick and easy checklist. And again, let me know if you think this would be easier to put on eSource, as like they do the triple check in the nursing homes, where you would literally go in there and say, I checked off, I did this, let me know. Okay, that's that. What are we doing on time? All right, finance. Grab my little Adobe here. Okay. CVS Pharmacy is calling on my home phone. Hopefully it's for a shot for my husband. Okay, so how are we doing? Here's the system-wide performance. So again, the variance here, we're doing really quite well, $25 million plus. However, you can see that net operating income is only 680,000 plus. Majority of that is coming from non-operating income. If you look down down a little farther, you can see that here is the purple is the housing with services budget, where we're supposed to start increasing right now in our census, a little bit of a drop. We're still going down. The nursing home is kind of leveling out, coming up a little bit, which is really good. And we're still struggling a little. So all of the things that we've been talking about, I know we're going to help that. So keep plugging away. Scrolling down, we're going to look at the finances again, this time without the COVID revenue. Again, we're still doing quite well, $17 million, but again, it's coming from this non-operating income, where if you take out the COVID dollars, we've lost $7 million right now. So COVID, pray Lord, is coming to an end, but in the meantime, so is the money. So just keep an eye on that, because without that money, this is what our reality looks like. So we really want to watch the expense, the revenue, the census. Focus, focus, focus. Just scrolling down. These are just the percentages of income or loss. Okay, so scrolling down, the left or the right, my right is the budget, the left is the actual. So if we look down this column right here, is our census. We are budgeted for a 94% occupancy, and we are only at 83.9% occupancy. So this is one of the reasons too, that as Patty talked about that and saying, hey, you know, when we look at this, Jerry Carley's looking at this every day, everybody's looking after it every day. If we're actually getting paid for 85% or even 86 or whatever it might be, you know, we want to give you credit for that. So that's also another reason that we're having that discussion. Scroll this over. So housing is this column right here. You can see there's some negatives, some positives. But again, budgeted a loss of 1.21 million, and we're actually at a loss of 1.86. So it's actually not too bad, but again, it's got those COVID dollars in there. And a lot of where we're losing, if you look at these big hitters here, and where's the other one? There's a big Northfield in here. Let me scroll over. There's Northfield here, Shakopee and Northfield. They're going to make up for a lot of that, though. Way to go, Northfield and Shakopee, because you're both ahead of budget. Good job. Yeah. So again, without COVID, loss of 1.21, which is basically Northfield and Shakopee, which is the planned loss, and we're at a $2 million. So need to watch this very carefully. Here is our ministry partners, the Serenities, Little St. Benedict, same scenario with them. We're all in a tough spot at the moment here. And here's what's causing it once again, 84% occupancy and a 90% budget. And that's about it for that one. Any questions on that? All right.
I'm just curious, Penny, are folks out in the field, are you seeing people more interested in admitting now that there's vaccinations and low COVID rates?
Somebody want to take a shot at answering that for Jerry?
What was the question again, Jerry?
Are you seeing a renewed interest for people to admit to the assisted living or housing now that there's lower COVID rates and vaccinations? I saw a couple, Kendra said people who don't have to move seem to be staying put. Kelly Ray saying they're seeing increase down at Red Wing. I was just curious.
Hi, Jerry, it's Barb. We're seeing our phone is actually almost ringing off the hook right now. So maybe it depends, I guess, by location, but a lot of demand right now for AL.
Good.
Great, because we've got a lot of apartments to fill. Last week we had 2 admits. We have 2 admits today. So yeah, IL not moving quite so fast though.
Okay. And that kind of makes sense if you have some place to live in, you know, where AL, you need some services. Thanks, Barb, Kelly, Kendra, all of you for responding to my question.
And I'm hearing that a couple weeks ago, I was on Jackie Glenn's call for the sales where they were kind of reporting, and I think it's very similar to what Barb said, but they even though maybe not ringing off the hook, but they're definitely seeing an uptick in the IL too. So there is hope here. Okay, so here's our dashboard. Let me just check the chat, make sure. Or Jerry, you're watching the chat. Is there anything else that we should cover right now? I don't see the chat.
Slow but steady increase in Northfield. Let's see. Kelly said AL, yes. So some people are seeing especially the AL pickup.
Okay, good. So here's our dashboard. Again, lots of green, which is really good. Here is the satisfaction to spiritual care, which is yellow. And again, this is a once a year thing, not a month by month. But it is time, as I remind you every month, to start reminding people. We're going to do our surveys a little bit different this year, and more information from Becky and Jerry will probably be coming out about that very shortly. But again, remind them of all the one, despite the horrible year that we've had, all the things that you have done, all the things that we've tried to do to make their life as comfortable as possible, so that they can remember it, and make sure that you just give them treats in order to fill out that format, throw parties, socially distant parties, whatever you can do to get them to complete that survey so we can get a good response on that.
I think that the emails have all gone out about that. We're doing a paper survey in the AL, so you should have sent the number of surveys you need, paper surveys you need to Key Leland, and I'm not sure if the cutoff date, I think it might be today or tomorrow. So if you haven't done that, you want to make sure you do that so you don't have to get those follow-up emails, and then we'll get them out to you. You'll complete them, send them all back to the Duluth office, and they will do the data entry for you. So,
Jerry, it's Bill. Who do we send? How many surveys we need? I didn't see anything in regards to that.
I don't remember when it went out, but I will ask Becky to resend it, that email to you all. Does anybody have
you.
the date handy? It goes to the housing manager. It won't go to nursing.
Jerry, it's Kelly from St. Kristen. I think it went to the executive directors and then the QMCs.
Okay, I'll double check.
Yeah, so
Yeah.
maybe Jerry will double check and make sure it goes to the housing leaders as well. So I have an error in my PowerPoint because my PowerPoint clearly says that Linda Johnson is on PTO. However, I can hear her talking. So Linda, are you on the call? Linda? Oh, now she's going to get quiet on us. Linda? Okay, so I'll give the update for Linda. So again, she continues to, all of the buildings that were in the first plan have been trained, are in the process of going live, and then she has moved on to the buildings that were added kind of after the fact. We were purposely waiting for Villa St. Benedict to be last because they had the AOD and they weren't on the Benedictine systems as a whole. So they are now in the process of transitioning onto Matrix, and they will go live at the end of March. Escaline, Lynn has been out and has started working with them. So they're in the process of the full transition. So very shortly, all of us will be up on Matrix, which will be great because then what that's going to allow Linda to do is not have to live in two worlds where she's implementing while she's supporting. So we can really kind of focus on that. How's everybody doing? Are they understanding it? Are they compliant, etc. So again, just a reminder though, that Linda still is kind of living in both worlds. So make sure that your content experts know how to change those passwords, know how to set people up, know how to kind of, you know, own this product because we're moving past implementation into standard support. So just a reminder on that. And then the other thing we're doing, a couple of places, Shakopee, I think Marion's using a little bit, but formally we're doing a pilot down at Madonna for using Matrix for housekeeping. So we would schedule housekeeping in just as we would schedule in nursing services. And the people who have seen that, I've showed it to the EVS task force or committee, and they really, really like it. Think it's super simple. So again, continuing to expand that use in Matrix in partnership with TELS. So more to come on that. Okay, so I'm going to pause for questions because the rest of the meeting is for Minnesota only. Any questions? Okay. So for those of you who are not Minnesota, we are changing to a new license. So there will probably be a little tag on for Minnesota for the next several months. But I thank you for everything you do. Have a good day. Feel free to log off. And if you have any questions, let me know. For Minnesota. Okay, so I am not Ben, but speaking in the short vernacular, as we've all been watching the housing or assisted living licensure, it is still on paper slated to go live August 1st. There is still rumors that the state is saying, I don't care what the paper says, we can't go forward, but we need to be prepared just in case. And as we talked earlier, you know, we've seen people say, oh, well, we're not going to worry about it, you know, in the SNF side, but then they come and they still hold you to the full thing. So we don't want that to happen to us on the AL side. We want to be prepared, despite the fact that they may say to give us some grace here. So what we really need to focus on right now is your budgets and the housing leader applications. So the housing leader applications will open. Right now, the BELT's website is saying May 1st. I have heard rumors that it may be in August or April. They're trying to open it as quickly as possible. So if anybody's heard anything more updated, please weigh in here. And it must be in by June 1st to be grandfathered. So you need to budget for, there was a call with Ben and myself and all the housing leaders to talk about who is your bench strength, who in your building needs to or could qualify as an assisted living leader, and how deep do you want to go in order to assure that you don't have to hire an outside consultant to meet this criteria. So again, if you weren't on those calls with Ben and I, if you're kind of newer to that, then it would clearly be the nursing home administrator, it would clearly be the housing leader, and then there may be 1, 2, or 3 people, depending on the size of your community, that you would want to back that up that would meet the criteria. So I'm going to go through the criteria. And then again, in budgeting, I want you to plan that we would license all of your units. Your AL and your memory care are no brainer because they're already assisted living, but your IL, currently we are planning on licensing all ILs as assisted living, because we understand at this moment we can still market it as an independent living. And if we want to be able to provide aging in place services, such as at your service, we cannot do that unless it is licensed as an assisted living. So almost all of you have at your service. And so in order to continue that, plan for that. Questions there? Okay, so here are the pathways. They've been updated. This is straight from the Belts website. So again, if you are a licensed nursing home administrator, this will automatically grandfather you in. Pathway 2, higher education degree. So education requirement is college or university degree in nursing, social services, or mental health, or another professional degree. Employment experience, training specific to assisted living. And get ready, prior to the online application, you will need your official transcript of highest academic degree earned will be required. Look up your academic registers procedures in order to have an official transcript, and work history, resume, listing training as it relates to the domains of practice specific to management and regulatory compliance. So long-winded, they need your transcript. I know I've had to pull my transcript, and it took some time. And so again, considering that it has to be in by May 1st and it closes on June 1st, I would get on this right now if this is your pathway. Pathway number 3, 3 years of supervisory management, operational experience, and training. In order to apply for this, you need your highest level of education obtained, no less than 3 years of supervisory management or operational experience and training applicable to an assisted living facility. Get ready prior to online application. Prepare to provide online work data history since high school pertinent to assisted living or high school management related to the 3-year requirement. Prepare a work history resume. Request a work validation letter documenting work dates, position titles, number of people supervised or managed by the owner, HR, or another licensee. So I know of one of you who we hired from a hospital system who does meet this as far as supervisory training. They've also got the education and such. And so again, you'd want to look at, well, do I go under number 2? Do I go number 3? Where would I fit into this? And so again, if you do have a background in assisted living supervision, you're going to need to get a validation letter from your previous employer. So start on that. And then pathway 4, 1,000 hours of administrator and training. I don't know that anybody would actually fit this criteria, but it's here. 1,000-hour executive training program provided by a licensed assisted living director. And since there isn't such a thing, don't know how you'd get this. But if somebody knows better than I, weigh in here. Prepare to provide online work history since high school to assisted living or healthcare management, and the 1,000-hour AIT, EIT, and work history online application. Prepare your work history in your resume. Request a work validation letter documenting AET dates, position, community location, names, credentials, etc. And the only thing I can think of here is if your LALD is an LALD because they are a long-term administrator and you've worked under them for 1,000 hours, that might fit, would be my guess here. Pathway 5, housing with services under ALD designation. Manage a housing with service establishment operating under assisted living title protection in no less than 3 years. Get ready prior to online. Prepare prepared to provide online workday history since high school, or healthcare management, and at a minimum of 3 years as a manager of an AL. Prepare a work history resume listing the total clients within the MDH licensing categories. Assure you have 3 years to meet this requirement in one or more sites. Request a work validation letter documenting your AIT, EIT dates, position title, community, etc. So again, what I think is different than the communication we've been giving you last time is it was, okay, here's the people who meet it, here's what the criteria is. Now it's the documentation of what you need to get between now and June, and I would say May 1st, again, to the process, but no later than June 1st for this application. Questions? Such a quiet group.
Penny, I know we've talked about getting more than one individual, getting some bench strength at the community with this licensure, if possible. Any recommendations there?
Yeah, we've been looking at probably, if you can, at least 3. One food of thought is at least 3 deep. Just because people move around or people may have to go out on an LOA or what have you. So I would say if at all possible, try to go at least 3 deep. Some of you, have a lot of people who qualify. And again, I would leave that up to you if you're feeling like, if we want to give people a chance to do this, it's something that, helps them to build their resume, their career. I know Barb, and again, you may just want to unmute yourself. You've got many people that qualify, so you're kind of trying to figure that out right now. Any thoughts, Barb?
Well, I think it's kind of a process to try to figure out who could be grandfathered in. And so that's my first job, is to figure out who actually meets what requirements. We will be doing at least 3 people and potentially even a couple more, just because this is the easy way to get it right now.
Yeah.
And if anyone has any notion of ever doing this and they meet the qualifications, they should probably do it right now.
Right.
And then again, you get into how many are we going to pay for, but.
Right. And so again, those are the budgeted, who you would budget for. So, I would think that the 3 in my mind that are kind of the no-brainers, and then the rest is more where you're thinking is the nursing home administrator is going to fit the criteria, the director of nursing is going to fit the criteria, and the housing leader is going to fit the criteria in most cases. In some cases, your business office manager is also going to meet, and right there you're 4. Okay. Well, that takes us to the end of the meeting. Let me just
Penny,
yeah.
I also believe we want to encourage everyone to attend the Leading Age Minnesota series on this new license. I believe I have not attended yet, but do plan on it. I know you have to register for these, and the next one is really around the day-to-day operations, not so much on the qualifications of the ED, et cetera. So we'll figure out to get those dates to you and that information, and do take advantage of that opportunity.
Thank you for that reminder, Jerry. Yeah, I think I still have it in my inbox. I'll send it out to you guys. And it does cost $50 a session to go. However, if you just do it and get everybody into a conference room, then it makes it an affordable way to do it. So.
Anyone else is aware of it? I've done like that since yesterday.
Okay, well, with that, I will end the meeting. I thank you all for everything you do. Have a blessed day, and I'll talk to you soon.
Thanks, Penny.
I just asked her when it started, and she said yesterday.